Following the recent detections of 6 polioviruses in Kenya and 1 virus reported this year in Uganda through environmental surveillance, health authorities have put in place common strategies not only at national levels but also regionally to create awareness around the virus.
It is transmitted through fecal matter. So if you have polio, then you defecate in the wrong places, or even if we are using the water, maybe sometimes to even water our vegetables, then we don't wash them correctly.
Polio is said to be a highly infectious but vaccine-preventable disease that most commonly affects children under the age of 5, attacking the lower limbs among other effects.
Na mtoto anapopooza atapata shida ya kutembea na hairekebishiki.
It is also known to even cause respiratory problems. Anywhere there's a muscle, polio could affect it.
With the recent vaccine campaign by the Ministry of Health and other stakeholders, parents have been seen to raise concerns, some saying their children have been affected while others receiving the vaccine with open arms.
So the only reaction that I experienced na polio ilikuwa rashes kwa mtoto. But after a short while ilikuja ikaisha.
Experts on their part say there is no direct linkage of the vaccine to the effects experienced.
We are moving away from using eggs. We are using eggs, yes, but less and less. So the allergens, the allergic reactions that were there before are not as rampant as they used to be. So we are getting safer and we are moving away from using animal products.
So wakati mwingi Wizara ya Afya inapopata outbreak katika borders zetu, tunafanya hizo campaign.
The number of dosage has also been a concern, and considering that polio has no cure, prevention through vaccination could be the only way to go.
Mtoto anapozaliwa anapata hiyo 0 dose ya polio vaccine. Baada ya hapo, baada ya wiki 6 mtoto atapata oral polio vaccine 1. Baada tena wiki 4 mtoto akikuwa wiki 10 anapata dozi ya pili. Alafu mtoto akikuwa tena miezi 14 weeks, wiki 14 anapata the last dose ya oral polio vaccine.
Zinazidi zaidi ya 3 wakati kama kuna mkurupuko ama kuna kisa kimetokea, ila kwa kawaida mtoto atapata chanjo ngapi? 3.
When you think you've been exposed, which you don't, how would you know you've been exposed? There's also post-exposure vaccine. So you can take the vaccine post-exposure, and that could also help in some cases.
So far, at the Mama Lucy Hospital alone here in Nairobi, they have already vaccinated 7,674 children with an aim of vaccinating all children below 5 years.
Na hizi sub-county zingine pia zimechanja wengi tu. Kwa mfano kama Bahati imechanja watoto 10,000. Target yetu ni kwamba tufike kila mtoto kwenye umri huo akuwe amechanjwa polio.
6 years ago, polio had about 350,000 cases worldwide that were active. And a lot of people, especially young kids, were dying from polio. So Lottery made a decision, since disease education is one of our areas of focus, to intervene with other partners that included the UN and other bodies.
Stakeholders are also calling for more funding to protect children against polio.
We have a drive for what we call Polio Plus funds as Rotary. So we get our partners who contribute, members also contribute, and we use those funds together with our partners to do this education in areas that we feel have got a high prevalence of polio.
Robbie Omondi, K24.